Earlier, I spoke with Dr. Jason Efstathiou, who has never treated the former president, but who can answer some key questions for us. Dr. Efstathiou, thanks so much for joining us. I want to ask you what the significance of the cancer spreading to former President Biden's bones means.
When cancer has spread beyond the prostate, most commonly it's spreading to either lymph node or bone, and it's then called metastatic prostate cancer. That is usually not curable, but it certainly remains very treatable, and men can live years with metastatic prostate cancer thanks to the advances in medicines and treatment.
And we've heard of this Gleason score. What does a Gleason score of 9 exactly mean?
Gleason score is the grade of the cancer, how aggressive or abnormal it looks under the microscope. The higher the score, the more serious or more aggressive it is. The scoring system, the Gleason scoring system, goes from 6 to 10. 6 is considered low risk, 7 intermediate risk, 8 to 10 is high risk. So a Gleason 9 prostate cancer is more aggressive, which means that it can grow more quickly and can be more likely to spread.
Now, we're also told Biden's cancer, quote, appears to be hormone sensitive, which allows for effective management. What does that therapy involve?
Hormone sensitive means that hormone therapy is used. Generally speaking, metastatic prostate cancer is treated with a combination of therapies these days, but the backbone is hormonal therapy, and that's reducing testosterone, which is the fuel for the prostate cancer. By reducing testosterone, you're sort of starving the cancer cells, and you're preventing them from growing further. So that very much is the backbone of treatment.
I know you're not involved personally in treating the former president, but what can you say about a prognosis, or the big question, the typical survival rate?
The average survival is probably on the order of 3 to 5 years. That said, there are many patients that can live longer than that, and the best predictor of that is how do they respond to treatment, and do they have access to modern therapies? So while it's serious, I think there is hope, and there's been a lot of progress. If we just look at the last 20 years, there have been over a dozen new therapies that are used to treat metastatic prostate cancer.